Hey guys, Jonathan Yerasimides here at Louisville Hip Knee Institute in Louisville, Kentucky, obviously. If you guys come to us or you're thinking about coming to us because you know you need hip replacement surgery, and you're worried, like everybody is. Everybody's worried, especially on the first time. You have no idea what's going to happen. You don't know what it's going to feel like. There's a lot of apprehension about how much pain there's going to be, what risks am I undertaking? Is this thing ever going to feel normal afterwards? It's a difficult question to answer because really we're trying to look into a crystal ball and we're trying to use our experience to help you better through what the risks are versus what the benefits are. Because you shouldn't go through a surgery unless you're both physically and mentally prepared. I have a lot of patients that come in that are physically there. They hurt. They have poor range of motion. They can't put on a sock and shoe, but mentally they're not ready yet. And so those people shouldn't have surgery, because in order to have surgery, you really need to be there physically and mentally. And what do you need to get mentally prepared? Well, most people need to know that this is going to be better than it is now. And they need to know that it's going to be safe, that I'm not going to do something that is going to put me at risk of having a worse complication than the problem I already have. And surgery, unfortunately, is not without complications. Every surgery you undergo, every time somebody cuts the skin, you're at risk for complications. Now, what are the complications that can be associated specifically with hip replacement? Well, the thing we worry about the most is infection. And why is that? When you get an infection from like a cut on your skin, you take antibiotics and it can get better. You know, if you had a soft tissue type surgery and you had an infection locally of the wound, you could take antibiotics and get better. The reason why infection with artificial hip surgery is so worrisome is because we have artificial parts in there. So when you have pieces of metal in your body, if bacteria get around that metal, bacteria have a way of adhering to it. And when they adhere to the metal, we can't treat it with antibiotics. If your cut on your skin gets infected, you take antibiotics, that antibiotic goes in your bloodstream and it gets to all the tissues of the cut and it kills the bacteria. If bacteria get around an artificial hip, well, that artificial hip doesn't have a blood supply. Therefore, no matter how much antibiotics you take from orally or an IV, nothing's going to get to that implant, and the bacteria can continue to multiply and get worse and worse. This is why infection is our #1 concern. Now, what are some high risks for infection? Well, high BMI has been associated with increased risk of infection. So patients over a BMI of 40 are a much higher risk of infection than patients that are smaller. Other diseases that cause you to be immunocompromised, like diabetes, increases your risk of infection. If you're on chemotherapy because of cancer, increased risk of infection. If you're on medicines that suppress your immune system for things like Crohn's disease or ulcerative colitis or rheumatoid arthritis, those can increase your risk for infection. Now, we have ways of trying to offset these risks by putting people on oral antibiotics afterwards, using special dressings, but these are always a concern. Infection is our #1 worry, because if somebody gets an infection around an artificial hip, you're guaranteed to have at least one more, if not 2 or 3 more surgeries down the road. So that is a major concern for us. Old worries like dislocation of the hip. Those used to be concerns with other approaches, like the posterior approach. And you may have family members, or you may have, you know, parents or grandparents that experienced hip replacement 20 or 30 years ago and told you, I couldn't cross my legs or flex above 90 degrees because my hip might pop out of socket. Or maybe you knew people that did pop out of socket. With an anterior approach, the risk of dislocation is minute. It's about 1 in 800 in my practice. We don't put people on hip precautions because it happens so infrequently. It's one of the rarer things that would happen with an anterior approach hip replacement. Other risks like nerve damage. You'll hear about this a lot from an anterior approach versus another approach, nerve damage. So when we cut the skin on an anterior approach, there's a sensory nerve that controls the sensation to the top of your thigh. And that nerve does not run in a consistent place every single time, so we can't plan an incision around it. So there are patients that will have numbness over almost half their thigh, all the way down, maybe halfway to the knee. Now, it's sensory numbness only. It doesn't control any motor function. It doesn't control your power, but it may make the top of your thigh feel numb. Most people just experience a small area about the size of a baseball or softball right next to the incision. But some people do have numbness all the way down. Now, sensory nerve pain is a much rarer occurring complication that unfortunately does happen. If the nerve doesn't get cut but simply gets stretched by the time of the surgery, people will start to experience a burning sensation or hypersensitivity to the top of the thigh. Although this is normal in the first 2 weeks because of swelling and inflammation causes aggravation of that sensory nerve, some people will have it permanently after that, and that can be a tough thing to get over. Fortunately, it does get better with time, but it gets better slowly, and it takes over a year to get better. One of the other things that many people talk about and that ask me is, what are the risks of fracturing the bone when I'm putting the implant in? Because when we put these implants down the middle of the bone, most implants are put in what we call a press-fit manner, meaning we don't use cement. I'll still use cement in someone who has osteoporosis, a very weak bone, but most patients get uncemented implants. And driving this implant down the bone and trying to get it mechanically as tight as possible so that it has stability and bone can grow to it versus going too far and fracturing the femur really comes down to experience and comes down to feel. And that's where having a surgeon with a lot of experience would be an advantage over having a surgeon who hasn't done very many anterior approach hip replacements. I can tell you for myself, having done over 11,000, that fracturing a femur in the operating room doesn't even happen once a year. So it's very, very rare, but still, nonetheless, it's a possible complication. The damage to the femoral nerve, the motor nerve to the thigh, I've never seen in my practice, in my experience with dealing with revisions on other surgeons that have had it, have been just simply being in the wrong place and not being in the right interval of muscle. So I really don't think about that at the time of surgery, and it's something that hasn't plagued me or hasn't been a problem in 17 years. The number one reason for somebody to be dissatisfied with their hip replacement is leg length discrepancy. So traditionally, with a posterior approach, dislocation is the number one problem. So how do we reduce dislocation? Well, one of the ways of reducing dislocation is to increase the length of the leg. Well, why does that work? Well, because with this artificial hip, there is no constraint of the ball inside the socket. So the only thing that holds the ball in the socket is the pull of the muscles around the joint. Now, think about a rubber band. if you pull a rubber band, it gets tighter and tighter and tighter as you pull it. Your muscles are the same way. So the longer you make a leg, the more stable it is. Now, fortunately, with anterior approach, hip dislocations are not an issue. And so we don't have to artificially lengthen a leg in order to gain stability. The other thing that benefits us as anterior approach surgeons is that we operate with the person laying flat on their back. So it's easy to bring in X-ray at the time of surgery, which I do every single case I've ever done in my life. And we use bony landmarks on the X-ray from the femur to the pelvis. And we do measurements in the operating room to make sure that those are symmetric to the non-surgical side. So that way we get the correct leg length, because if your legs aren't the correct length, you're not going to be happy. You're going to have back pain, you're going to have a limp, and you're just not going to feel right. One of the things I do the week before surgery, and today we're shooting this on a Wednesday, and I've already done all my templating for the following week, because I prepare the week in advance. So what I'll do, like on this particular X-ray, this is an X-ray just taken in our office here. I'll bring up a templating program. And this templating program allows me to look at the cup. So I can put a cup up here. I can change it to big, I can change it to little, and I change it to a size that I feel like fits the person's anatomy. And then on the stem side, we can also change the size, big or small. We change it to a size that we think is going to fit the person's anatomy. And what we're trying to do is get the centers of rotation of where the potential ball would be to meet the center of rotation of the cup. Now, this is a good kind of rough estimate, and this isn't gospel. But this gives me a really good idea in the operating room when I'm going in to do your hip replacement of where I need to make the cut on the femoral neck to seat that stem, and where I need to position the cup in the pelvis so that I'll come out on the other side with your legs being equal length. And this, in my 17 years of experience, has led to very, very, very few leg length discrepancies. But every surgery is a risk, and you should consider every risk with every surgery and decide whether the benefits of that surgery are going to offset the potential risk you undertake. And you have to be ready from a physical standpoint and a mental standpoint. And if you are, give me a ring at Louisville Hip Knee Institute, and I'd be glad to see you and get your problems fixed. Thanks.